Hello and welcome to this module on financing urban sanitation, where we'll look at what and who needs funding, why government should fund non-sewered sanitation services, closing the funding gap, sanitation financing mixes, and sources of revenue. Estimating capital and operating costs and developing a finance strategy is routine work for consultants. There are numerous models and examples to draw on, but they're mostly for sewerage systems. Citywide inclusive sanitation services include more service chains with many different components, and also the often neglected but essential community consultation, sanitation and hygiene promotion and marketing of the new services. In addition to the infrastructure and equipment needed at each stage of the service chain, there are different service providers who need to cover their costs. Also, additional funds will often be needed to build their capacity and provide technical assistance. Communication and promotion should be carried out by specialist companies working with local government staff, NGOs and CBOs. Toilets and containment facilities are usually financed by households, and lack of finance is a common cause of substandard facilities. Masons and materials suppliers also need working capital, as do utilities, if they're involved, for instance with sewer connections. Emptying and transport service providers need equipment, carts, tanker trucks, pumps and so on. Utilities, developers or local government may all need to invest in sewerage networks or sewage and fecal sludge treatment facilities. The private sector, NGOs and farmers associations may require funds to develop and invest in the emerging business of reuse. Why should public finance be used for non-sewered sanitation? Firstly, it's often more cost-effective than sewerage, especially away from high-density multi-storey city centre areas. While every city is different, a 2012 study in Dakar, Senegal, found that the total annual per capita cost of sewerage was 5 times more than for non-sewered sanitation. Historically, subsidised investments have been made in sewerage, which often serves business and higher-income residential areas. But low-income residents, especially in unplanned areas, have been expected to pay for their own sanitation. In Dar es Salaam, Tanzania, 99% of public expenditure on sanitation in 2012 was for sewerage, which serves only 10% of the population. That's 1,000 times more per person than for non-sewered sanitation. This is highly inequitable and has limited impact on improving public health in the city. What households spend on investment, user fees and tariffs usually falls short of the actual cost of capital, operation and maintenance. This creates a funding gap, but there are ways to overcome this. Firstly, reducing costs, which can be done in a number of ways. These include improved technology and equipment and technical assistance to improve procedures. Restructuring the market can improve competition and drive down prices, whilst also helping service providers by increasing customer numbers. Guaranteeing service provider revenues by an advance commitment to purchase a minimum amount can create economies of scale and reduce the risk premium. Secondly, microfinance can assist in smoothing large expenses like building a toilet or desludging it, although it may sometimes be unaffordable due to high interest rates. Microfinance products tend to be for income-generating activities, but there has been some success in developing specific products for sanitation, sometimes with subsidised interest rates. As mobile money becomes more popular, it can reduce the cost of administering credit, making it more affordable. Thirdly, subsidies are an option, but they need to be well targeted. There's a trade-off between targeting subsidies to the most needy and the cost of assessing poverty levels. Some common targeting options are to subsidise the minimum service level, or low-income areas, or households with certain poverty indicators. Many others are possible. Subsidies may be funded by cross-subsidy from water or other utility tariffs, a sanitation levy on water bills, municipal revenues, conditional cash transfers, sale of reuse products, or other sources. Large cost items like a toilet, a sewer connection or desludging can be made easier to pay for by spreading them over time using credit or incorporating them into a tariff. Finally, in addition to microfinance for consumers, repayable finance is also useful on a larger scale for service providers and utilities. A financially viable utility may be able to access concessionary credit from an international development agency, either directly or through government. It may also be able to mobilize commercial loans, although the terms may be demanding. Sanitation is an unfamiliar business to most financial institutions, so they're reluctant to lend to service providers. The business development package for service providers should include the facilitation of contacts with suitable lenders and information for the lenders on the viability of sanitation businesses. Financial instruments can reduce the risk of lending to sanitation businesses. A guarantee fund was successfully used in Senegal to reduce the cost of borrowing by vacuum tank operators. This enabled the old vehicles to be replaced and an increase in efficiency. Revolving funds have often been used for toilet construction and small emptying businesses. They can be run cheaply by financial institutions as the externally contributed capital is risk-free. Results-based or output-based financing can reduce financial risk and the overall cost of capital. The financial institution advances the capital and receives part repayment from the project or program when predefined targets have been met by the service provider. Targets could be, for example, a number of toilets built or pits emptied within a specified period. As we've seen, there are many options for financing sanitation according to the different types of service being funded and how the local economy works. Your part in designing a project or program is to find the best combination of options. As this graph shows, the mix can vary. Comparing low-income Ghana with middle-income Brazil and Morocco, the biggest difference is the proportion of tariffs, shown in blue. This is mainly due to the higher coverage of sewerage in Brazil and Morocco, while in Ghana, self-provision with on-site systems and international development finance play bigger roles. Inclusive sanitation programs formalize non-sewered sanitation. This opens up a range of funding opportunities not available to the informal sector. We've discussed some of the options in this table already, and we'll look at some of the others now. The operation of publicly owned vacuum trucks is often funded largely by deferred maintenance. They're allowed to break down and can't be repaired. This is an argument for working with the private sector rather than buying new trucks for a public authority. As we've seen, costs can be reduced by retiring old obsolete trucks and bringing in new ones. Where prices are controlled, it may be possible to make emptying more affordable for poorer pit latrine users by cross-subsidizing emptying from higher fees charged for septic tanks. Deferred maintenance also applies to treatment facilities, and again, private sector participation may help to solve it. Where private operators are introduced, they can contribute capital to develop the treatment facilities as part of the agreement with the sanitation authority. An idea that has had some success is reverse tipping fees. This ensures delivery of fecal sludge to official sites by paying a small amount for each delivery. The treatment plant maintenance is funded by license fees or other revenue to the sanitation authority. Most of these options for sewerage are well known, but one which I'd like to mention is to increase connections by incorporating the connection cost into the tariff, much as mobile phone contracts include the cost of the phone with the monthly tariff. Low connection numbers make sewerage even more expensive per capita, so the removal of barriers to connection is important. In this module, we've looked at why funding is needed, not only for infrastructure and equipment, but also developing service providers and sustaining services. Non-sewered sanitation needs funding as it's often much cheaper than sewerage and can extend improved sanitation services to many people who were previously unserved. It's also flexible and adaptable, quick to establish and easy to remove if necessary. There are many ways to fund the public good gap between actual costs and household willingness to pay. An appropriate mix of funding options needs to be selected for each situation. Thank you for watching.